Bismillah ar-Rahman ar-Rahim. I'm Dr. Khadija Arif, resident radiologist at one of the renowned hospitals in Lahore, Shaikh Zayed Hospital. The topic of the study that we conducted is a spectrum of MRI findings for morbidly adherent placenta, a need for standardization. It is a very important study because it helps us to diagnose a life-threatening condition, which is morbidly adherent placenta, before the delivery of the child. And MRI is one of the best imaging modalities, and it helps us to accurately determine when the placenta is adherent to the uterus. I'll try to explain what it is actually. Morbid adherence of placenta is a high risk pregnancy condition. It can lead to severe postpartum complications, and it should be aptly diagnosed antenatally. These images show how a normal placenta looks like and when it is adherent to the uterus. The first image shows the normal placenta. This is a gravid uterus, a pregnant uterus, and here you can see the placenta. Normally, the placenta is just attached to the uterus, and after the delivery of the baby, it can be easily detached from the uterine wall and it is retrieved after the baby. In morbid adherence of placenta, what happens that the placenta closely adheres to the uterine wall, and after the delivery it is very difficult to remove the placenta, and when it's removed it causes severe hemorrhage, and this can be life threatening for mother, and it can ultimately lead to death as well. And there are different types of adherence of placenta: accreta, increta, and percreta. Accreta is basically just close adherence of the placenta to the uterine wall. Increta is invasion of the placenta into the myometrium, and percreta is invasion through the myometrium, and often it invades the adjacent structures, which can be abdominal wall, it can be a bladder, it can be adjacent muscles. I'll show you a few examples in my presentation. And it is very important to diagnose adherent placenta so that appropriate measures can be taken to protect the mother as well as the baby at the time of delivery. MRI is one of the best imaging modalities, and it is used for evaluation of placental pathology because of its multiplanar imaging capacities, its better tissue characterization, and a very high contrast resolution. And our study was directed to determine its accuracy. Here, I've already told you the objectives of the study were to determine the diagnostic accuracy of MRI in morbidly adherent placenta and to establish the spectrum of MRI findings that are firmly predictive of morbid adherence of placenta. As far as the methodology is concerned, it was a case series study carried out over a period of 2 years in radiology department of Shaikh Zayed Hospital, Lahore. 22 pregnant females were included in the study, and patients were referred for MRI after an inconclusive ultrasound examination. By that, I mean the ultrasound did not determine whether the placenta, it was not, we could not confidently tell on ultrasound that whether the placenta is adherent to the uterine wall or it's not. So we had to refer the patient for MRI. And per-operative findings and histopathological reports were taken as gold standard. By per-operative findings, I mean if the patient was going to undergo a C-section and the placenta was easily retrieved, that means that the placenta was not adherent to the uterine wall, and after the delivery of baby, the placenta was retrieved. When the placenta was not retrieved, the patient had to undergo hysterectomy, that is the removal of the uterus, and that was then sent for histopathology, and that was the reports were then considered as gold standard, which showed whether the placenta was adherent to the uterine wall or not. As far as the results of the study were concerned, the highly predictive MRI findings were T2 dark bands, heterogeneous placental signal, direct invasion of adjacent tissue, focal myometrial invasion. I'll explain these few in a bit. The misleading findings included myometrial thinning, abnormal placental vessels, and tenting of the urinary bladder. This image is of a normal gravid uterus, and you can appreciate that it is a pear-shaped uterus with a baby in it. Here, this gray area is the placenta. And in this image, you can appreciate there's a fine line which we call retroplacental zone behind the placenta, and this is where the placenta attaches to the uterus. And after the delivery of the baby, the placenta is easily retrieved, and this area uh, sheds the placenta. And you can also appreciate the interior abdominal wall. And this is the interior abdominal wall, and this here, the gray area, is the rectus sheath. This is basically normal interface, interior abdominal wall interface with the uterus, and there's uteroplacental zone. Overall, a homogeneous signal intensity from the placenta. These are all the features of normal placenta. In this image, you can appreciate the MRI features which are seen in morbid adherence of placenta. For example, here you can appreciate the T2 dark bands. These are the dark areas as compared to the rest of the placenta. These are called T2 dark bands. Here you can appreciate these black dots here. These are the abnormal placental vessels. We call them signal voids in MRI terminology. And here you can appreciate the tenting of the urinary bladder, but I've already told you it's not very strong predictor of it, of morbid adherence of placenta. And overall, you can also appreciate that the placenta demonstrates a heterogeneous signal intensity as compared to this one, this normal placenta, which demonstrates a homogeneous signal intensity. In this image, you can appreciate that the placenta is closely adherent to the rectus sheath, which is part of the interior abdominal wall. In comparison to the first image, you can appreciate the rectus sheath very clearly, and the placenta is not invading into it. Whereas in this image, you can appreciate the penetration of placenta here. This image also demonstrates morbid adherence of placenta. This placenta here is the placenta, and this demonstrates the invasion into the lateral pelvic wall. This image demonstrates the adherence and penetration of placenta into the scar of previous cesarean section. This is the interior abdominal wall, and this part is the scar from the previous C-section, and placenta is penetrating into it. This is also morbid adherence. Here you can appreciate the tenting of the urinary bladder. This is a false positive indicator, or rather, I'd say it's a weak indicator of morbid adherence of placenta. And this you can appreciate there is the loss of uterus and bladder interface. In this image, this is the myometrium, which myometrium is basically the wall of the uterus. This image demonstrates the thinning of the myometrium. But during the surgery, the placenta was easily retrieved in this patient, and it turned out to be a false positive indicator of morbid adherence of placenta. In conclusion, MRI is recommended imaging modality for diagnosis of morbid adherence of placenta. However, inaccurate apprehension of observation can misidentify the pathology. Thank you very much.